This is Dr. Young at Aesthetic Facial Plastic Surgery, and what we're doing today is a lower eyelid lift. And this patient had really large bags under here, and they were predominantly muscle. So what we did was we dissected the skin from the muscle here. Here's the muscle, and here's the skin, because our plan was to take a cuff of muscle in order to take away the extra muscle that was causing the bags, along with some of the skin. But we just got done resecting a very thin layer of muscle here in order to get rid of the redundancy of the muscle, and our plan is to tack up this muscle from here all the way up in order to support the muscle. And then we're going to take some extra skin to remove the excess skin in the lower eyelids as well. And when you remove that extra cuff, it sort of takes away the redundancy, and this tacking sort of supports that new layer of muscle upwards, so it doesn't create an empty space. And then after this, we're going to assess how much skin we're going to take, and it's going to be a really conservative amount of skin. So thank you. We just got done tacking up the muscle up here. That's why you see a little bunching here. And we've already taken some extra muscle, and we're just beginning to sew the muscle together. We just did a suture here, and we're going to do another one over here. This is the upper edge of the muscle, and this is the lower edge of the muscle. And we're going to do another suture here. So we're going to continue doing this and sewing the rest of this muscle together, and then we're going to assess how much skin we can take, and we're going to be really conservative on how much skin we're going to take. And this is just one way to improve the lower eyelids. Another couple of options include, if there's just a skin excess, you can just do a little lower skin pinch, and what that entails is just taking a little skin here without violating any of the muscle or any of the deeper structures. You just take a little pinch of skin right underneath the eyelash. That's called a lower skin pinch, and that's good for situations where it's just extra skin. And what I commonly like to do is actually use fat grafting in this whole area to lift up the cheeks, as well as fill in the depression that usually forms through aging that occurs right along the inferior orbital rim. That's my most favored way. Another way that people work on the lower eyelid to improve that volume deficiency in the inferior orbital rim that creates the two mounds, the cheek mound and the eyelid mound, is they'll do the same approach, but they will lift up the cheek and lift up the whole cheek by pulling up on this muscle, and that's called a mid-face lift. And that will lift up the cheek. Sometimes it helps improve this nasolabial fold here, and it has the effect of lifting up this cheek as well as bringing more volume to this sulcus area, this inferior orbital rim that commonly forms through aging. That's called a mid-face lift. We didn't do a mid-face lift today. We just limited our dissection to the rim, and we took away extra muscle here, and we tacked up the muscle up here to reinforce this new position for this eye muscle. And we're going to continue sewing the rest of this eye muscle together. And then after that, we're going to assess how much skin. As you can tell, there's a lot of skin here that we could take. We're probably going to be really conservative in terms of taking that skin, though, and leaving a little excess to allow it to heal, or allow this area to heal without too much tension on the eyelid. Thank you. Okay.